we've done this long enough now that we know who's going to be a good patient.
Yeah.
And if they've crossed all the T's and dotted all the I's already, it's nice and smooth sailing, isn't it?
Yeah, definitely. But at the same point, you can understand why people have maybe given up on those things as well, because you're not getting results from that, because they haven't got a normal physiology. So I have sympathy for empathy for patients who come in and they're not doing the bits they should do. But yeah, hit the ground running is the best way to make progress, isn't it?
I mean, we talk about earn your reward, through determined effort, and if you're doing it and you're not seeing the results, you are going to give up. And why would you not give up?
Yeah.
It's like, if you're going to get comfort from eating, we're simple creatures. You're going to eat, and you're going to become a chunky monkey. And you go, now their journeys are going to be a little bit harder, but it's again, you have that empathy because we now understand we are very simple creatures.
Yeah. Ultimately, it's different for everybody. So you can't get a definite answer. But yeah, like you said, if you can do all the right things, generally, you're going to get progress quicker.
It's that terrible cliche, isn't it? Trust the journey.
Yeah.
But you've got to trust the journey, and they've presented with these negative symptoms of distorted physiology. And they go, right, I'm starting testosterone today, so it's like, yeah, let's go.
Yeah.
But they come in with either a mix of anxiety or excitement, and we give them a whole load of information, and they're trying to process all this information, and then suddenly it's like, now time for injections, and it's like, oh. But you can see them visibly relax when you give them their first injection, because you can say to them, it's going to be painless.
Yeah.
But until they go through that process and have that first injection, there's going to be some angst, isn't it? And you can see their shoulders just go,
yeah.
I told you.
Yeah. I was the same way. I'm a massive wuss with mostly getting my bloods done, to be honest. But so I thought, God, 2 injections there's no way I can do that when I first came as a patient. And every single patient has the same reaction, which is just, oh, okay, that's it.
Oh, right.
Some of it's even, oh, have you done it yet? I was like, yeah.
I make my classic, it's just a little prick joke, and then do you feel better?
Yeah.
And they just the cliche laugh, but it's like, it's fine, relax. You have to trust the process.
Yeah.
We're gonna be making decisions for you about your protocol. Just concentrate on what you can do, affecting a positive change to the outcomes you can impact. And that is not chat GPTing your protocol. Let us do the medicine. You concentrate on, stress, sleep, nutrition, exercise, and mindset, and just leave the rest to us.
Yeah. Most people's focus is like getting to the point of the new patient consultation and getting on TRT. But actually you then need to shift that focus to all the boring stuff, which is the stuff that actually makes the difference: diet, sleep, exercise, and stress reduction.
You can't rush it, can you? You can't undo the wrongdoings of 20 years with an injection. It's like, you have to keep working on things. And as we said many times before, it's a work in progress constantly. We're both dialed in on testosterone replacement therapy, but we still have to work every day at the things that we can impact a change to feel good. Because normal testosterone, how does that make you feel?
Yeah, normal.
What? do you feel like Superman? Well, unless you're Superman, you're not going to feel like Superman. You're going to feel normal. It's like, well, when you wake up, how do you feel? Are you motivated? And again, that's really down to you, because normal testosterone is normal testosterone, but it gives you the ability to start putting those little wins. And again, you go, day 1, let's go. But what are they going to expect in the first 4 weeks?
Yeah, everyone's a bit. So it's funny what you said before about, do you feel better? I knew as a patient coming in, because I was obviously a doctor before as well, that's not how the medications work. But in the car ride home, I did feel better. And probably a lot of that is just because mentally, it's like something's happening now towards actually getting better and feeling better. The first 4 weeks, so you've got that drug effect, haven't you? So it's usually quite nice for most patients, but you've got to kind of let them know that actually it's normal to have that kind of peak and maybe even feel a little bit Superman-esque for that first couple of weeks, but that will plateau and that's normal. And intuitively you think, okay, I just want that all the time. But you don't. it would get boring, yeah. It would get boring if you could sit around doing nothing and feel like that all the time. The whole point of life is to do those difficult things and get some reward and feel better for it, isn't it? So
it's that determined effort, isn't it? And again, the first 2 weeks is, you know, you're getting that peak and trough from the HCG, and as you say, you know, you can feel like Superman, and people often describe it as that honeymoon phase. And again, I want that honeymoon phase all the time. Well, you can't have that honeymoon phase all the time. You know, we're just going to normalize your levels. You know, you're not supposed to feel like Superman, but you're supposed to want to feel like Superman, so you go and do stuff.
exactly, yeah.
And again, we're going to raise those levels from a low state to a normal state, and that can be great, but normal is just normal. So the first 4 weeks, as you say, it's a drug effect, and it can be great. It can be anxiety inducing, because again, you've gone from a plateau of it, you know, okay, to fucking hell, I feel wired. And again, peak, trough. The drug has to get in your system and get stable before we go, how do you feel?
Yeah.
Peak, trough, it's unavoidable.
It's difficult, but you've got to accept that 4 weeks. Okay, this isn't how it's going to be forever. Maybe it's good and great, just enjoy it as you kind of go along for the ride. But equally, if it's not great, just accept. Okay, this is me. This is what I'm going to be like in a year's time, not next week or next month.
So we do bloods at 4 weeks, don't we? And
yeah.
I mean, you're not stable at 4 weeks.
Yeah, definitely not. It's just a check-in, isn't it, to make sure there's nothing going too wild that we need to pull the reins in on. Or equally, there's a small handful of patients, isn't there, that they notice no difference actually in the first 4 weeks, and maybe things need a little push in whatever direction it is. And that can be disappointing as well and frustrating for patients. So you finally got onto TRT and got what you want to do, but nothing's happening yet. Again, it's just a building phase, isn't it? You're working towards it.
And again, I think that point is important, because if you don't feel anything at 4 weeks, that's disappointing, but it's not for us, because actually we know those patients are going to be the patients that do well in the long run.
Yeah.
Because if you've had a massive reaction in 4 weeks, your drug's not the levels aren't stable yet, so it's going to go up, and you know your estrogen's probably going to go up, and so you are not going to feel amazing.
Yeah.
So again, it's to preempt, predict, and hopefully mitigate any problems that might arise. So that conversation at 5 weeks is just, you know, all right, how are we getting on? We get a little tweak, and we're going to do this before you're stable. So again, just gives them that reassurance again that we are looking after them, and this isn't like some dodgy clinic that's just going to send you on your way with your drugs and just go, see how you get on.
Yeah.
You know, we are looking after these patients. So we then review them again, don't we? We do a blood test at 10 weeks and a consultation at 11 weeks.
6 month reviews then, but a really important point is that if we are changing things, for example, in that 11-week review, we're always following that up with bloods 4 to 6 weeks later, and there's going to be communication about subjectively how are you feeling, alongside what do we think the bloods look like as well. So it's never a case of change it and just work, kind of, you know, leave you and see what happens. It's always, has what we've done actually made the difference?
Ultimately, the process is the process. It's been done thousands of times before. It's very structured for a reason. It's to make our lives very easy and to make their lives very easy. Because again, we can be objective in their subjective experience. We can help them when we can help them. And we can always look to improve things, because there's always something to improve. You know, you're never left to your own devices. There's always that level of support. But we deliver realistic expectations, because that's important. Lots of other clinics put adverts out saying you're going to increase lean muscle mass, your move's going to improve, or just like that. We want you to lead your best life, so go lead it.
So that 4 weeks, you might notice nothing at all. You might notice some negatives. You might notice some positives. It's all transient. By that kind of 10, 11 week mark, hopefully levels have kind of stabilised, and we're at a period where we can start actually, you know, making adjustments for that kind of long-term stability. You're then on 6 monthly reviews, but there's obviously work here in between that if you need anything, and obviously if we're adjusting protocols, we're definitely there, because we're going to make sure that we're following up on that. And then we see you annually. But it's a case of, I'd say that most patients are feeling more positive than they did before treatment by that kind of 10, 11 week mark. But it's really a year plus sometimes to get things really perfectly dialed in, that we're saying, actually, do you know what, that's fine where it is at the moment. But that doesn't mean that in the future it may not be, you know, life's changed, circumstances have changed, age has changed, and you actually need to do a little bit more tweaking. But I think it's always important, like you said, to just reflect and say, actually, do I need to mess about with protocols, or is it life around me that needs to change?
Trust the process.
Yeah.
Simples.